Okay, so in this episode, we're going to look at body cavities and mesenteries. So our body cavities are lined by a simple squamous epithelium we refer to as the mesothelium, and it has an underlying connective tissue. That mesothelium and underlying connective tissue are referred to as a serous membrane. Now, one thing to note is that within these body cavities, whether it be the pleural cavity, the pericardial cavity, or the peritoneal cavity, there are no organs in those, just a little bit of fluid that allows the organs to move easily across the surfaces without causing friction. The serous membrane that lines the thoracic cavity is known as the pleura. So that pleura, which is on the body wall, is known as the parietal pleura. Parietal simply means wall. Okay, so this is the pleura of the wall. Now that parietal pleura is going to be continuous with the visceral pleura. Now in the thoracic cavity, it's as if they put two balloons and created two serous cavities, and when they blew those balloons up, those two balloons came together in the middle, and we're going to find that there's some organs in between them. But this structure in the middle where they come together is what we call the mediastinum. So it's covered by mediastinal pleura. Now that mediastinal pleura that overlies the heart is going to be further defined as the pericardial mediastinal pleura. Over here we see the caudal vena cava, and the pleura that surrounds it is continuous with the mediastinal pleura via the plica vena cava. Okay, what we can't see in this image is that the trachea is within the mediastinum, and where it branches off to go to the lungs, we're going to find that mediastinal pleura is going to be continuous with that visceral pleura. Also here in the caudal aspect of the lung, in the caudal lobe, we're going to see a portion of the mediastinal pleura stretch across here and become continuous with the visceral pleura, and that's known as a pulmonary ligament. So let's have a look at that in a specimen. So here we've opened up the thoracic cavity. We see that part of the parietal pleura on the ribs. Sometimes we'll call that the costal parietal pleura. That's that shiny surface there. On the diaphragm is going to be the diaphragmatic parietal pleura. In a minute I'll show you the mediastinal pleura. But here on the lungs, this shiny surface is the visceral pleura. So as I said, the visceral pleura is what overlies the lungs. And if we have a look histologically, we're going to see that that is a simple squamous epithelium. Its underlying connective tissue here is continuous with the capsule of the lung. Now I mentioned back here at the caudal lobe of the lung, we have an area where the mediastinal pleura becomes continuous with the visceral pleura. So in this image here, we are reflecting the lung dorsally, and we can see this attachment right in here. And here we are reflecting it ventrally, and we can see that attachment right in here. Okay, that is known as the pulmonary ligament. So it's just a fold of that pleura. If we come over to the right side of the animal, we can find the caudal vena cava. And remember, we identified the fold of mesentery that is continuous with the mediastinal pleura as the plica vena cava. Okay, so now we've removed the lungs, and we can see all these structures here down the middle are covered by the mediastinal parietal pleura. Okay, we can just call it mediastinal pleura as well. So if we go back to our image here, so once again, here we have our mediastinal pleura. And within the two layers of that, we have the mediastinum. Now we have structures within that mediastinum. The esophagus, the aorta. Okay, I don't think I labeled this little vessel here, but that is the azygous vein. So we find now deep to our pericardial mediastinal pleura a fibrous layer known as the fibrous pericardium. So on the other side of that fibrous pericardium, we have another serous cavity which surrounds the heart, and it's going to have a parietal serous pericardium. So that's going to be the outer portion of that serous cavity. Then we have the pericardial sac, and then up against the heart, guess what we have? That's right, we're going to have the visceral serous pericardium. That is also known as the epicardium. So let's go back to a specimen again. So here we see the mediastinal pericardial pleura surrounding the heart. In the thorax, we kind of divided up using the heart as our reference as the cranial mediastinum, the middle mediastinum, and the caudal mediastinum. You see here that in the cranial mediastinum in younger animals we have the thymus. So if we now go and cut this pericardial pleura, we're going to then reflect it here and see the inner surface of that is the parietal serous pericardium. Now between that mediastinal pericardium and the parietal serous pericardium is that fibrous pericardium, which makes it really tough. So here's the outer wall of our pericardial cavity, which is the parietal serous pericardium, and on the heart itself is going to be the visceral serous pericardium, which is also known as the epicardium. We look at that histologically. We see here's the epicardium. We see within that epicardium we're going to have vessels and nerves and various amounts of adipose tissue. Okay, let's now move on to our abdominal cavity, which is lined by our serous membrane here, the peritoneum. Within that is the peritoneal cavity. So lining the body wall is going to be that's right, the parietal peritoneum. Now notice the kidneys are between the body wall and the parietal peritoneum. They are referred to as being retroperitoneal. So continuous out from there is going to be our mesenteries. And here with our mesenteries, depending on what it's suspending, is going to give it its name. So if it's suspending the colon, we're going to call it the mesocolon. If it's suspending the duodenum, mesoduodenum. We see that we have some pancreas within the mesoduodenum there. Then that's going to be continuous with our visceral peritoneum, which often we refer to as the tunica serosa microscopically. Okay, we look at these images on the right. Here's the mesojejunum and the visceral peritoneum, which microscopically we call the tunica serosa. And here close up we see that simple squamous epithelium, or the mesothelium, with its underlying connective tissue, which makes up our tunica serosa. These mesenteries, as you see here, are suspending from the dorsal body wall. So we have a sagittal section here through the animal laying on its back. We're going to find with the stomach we have a very long dorsal mesogastrium. This is referred to as the greater omentum. Unlike the other organs, we also have a ventral mesogastrium, which runs between the lesser curvature of the stomach and the liver, and that's the lesser omentum. Notice that there is a part of the pancreas in that dorsal mesogastrium. Now, we have overlap of that greater omentum. We're going to have a superficial leaf here, and we're going to have a deep leaf here. That space in between the superficial and deep leaf is the omental bursa. So here we're now looking at the greater omentum. Generally, when we open up the dog ventrally, we see that it's covering much of the internal organs on the ventral surface. Here I've kind of pulled that superficial leaf away, and you can see deeper to it is the deep leaf. Very lacy. It's going to have various amounts of fat depending on the condition of the animal. Now here I've reflected that greater omentum towards the head cranially, and we can see that within that is going to be part of the pancreas. Okay, so that greater omentum is coming off this greater curvature of the stomach here. So this is our greater omentum. Coming off the lesser curvature of the stomach and going to the liver is going to be the lesser omentum. Now in the ruminant, this greater and lesser omentum, especially the greater omentum, is greatly enlarged and important. I have a whole nother video talking about the greater omentum in the ruminant. So if you want to know more about that, please check that out. Okay, so moving on from the stomach, we then go down here into the duodenum. So here's our cranial flexure, our descending duodenum, our caudal flexure of the duodenum, and our ascending duodenum. And we see that within that mesoduodenum, we once again have the pancreas. So this is going to be the right lobe. What we saw in the mesogastrium was the left lobe of the pancreas. So we find that the duodenum is generally fixed in position because the mesentery is relatively short. Now, here we've got the animal turned the other way. If we take that descending duodenum and we reflect it away from the body wall like this, we then have exposed pancreas up there, the portal vein within that mesentery. We see the caudal vena cava and the caudate lobe of the liver. Right here between that caudate lobe of the liver and the portal vein, we have an opening known as the epiploic foramen. This is the only entrance into that omental bursa between the superficial and deep leaf of the greater omentum. So here we see now in the horse, we've got the mesoduodenum, caudate lobe of the liver, and there we have the epiploic foramen. This is important because sometimes a loop of small intestine will get entrapped up in there. They call that epiploic entrapment. It's a very harsh form of colic. Okay, so continuing along the descending duodenum here, we come to the ascending duodenum, and we find that there is a mesentery on the antimesenteric side, which is attaching to the descending colon. This is known as the duodenocolic fold, sometimes called duodenocolic ligament. So this mesentery right here is going to be consistent in all our animals, and where it terminates cranially is where the jejunum starts. Let me show that to you again from the other angle. So our head's going the opposite direction now. We have our ascending duodenum here, our descending colon here. We can see right here and right about here is our limits of our duodenocolic fold. And so right here would be where the jejunum begins. Likewise, if we look here in the horse, remember they're standing, so we have dorsal up here, ventral down here, and we have our ascending duodenum here, our descending colon up here, and we can see that right in through here, we've got that duodenocolic fold. So right at this spot right here is where we then have the jejunum begin. So then, of course, with the jejunum, we have a very long mesojejunum. So it's able to move around a lot more within the abdominal cavity. We get down to the ileum, and we see that, especially in the horse and in the bovine, they have a very long fold in between the ileum and the cecum here, which we're going to call the ileocecal fold. That's going to help us define our limits of our ileum. Likewise, in the bovine, we see the cecum in the ileum and the ileocecal fold. Yeah, and even in the canine, we do see the cecum in the ileum and a little bit of an ileocecal fold. But remember how we use the antimesenteric ileal artery, which runs along here, really to define the length of our ileum. So from here we go on into the colon. Here we see the descending colon and the mesocolon. Once again, the mesentery is quite short, so our descending colon is quite fixed in most of our animals. However, it is important to note that in the equine, our descending colon is very elongated and has a very long mesocolon, and so it is much more movable. And that's all I got.